President, I rise tonight to draw attention to the amazing work being done by the Prostate Cancer Foundation of Australia, the national peak body for prostate cancer in Australia. I'm sure everyone would agree that it would be nice if cancer would take some time off until the pandemic was over. Unfortunately, we do not have that option. Prostate cancer is quietly killing 270 Western Australians each year, with about 2,000 men in WA annually being diagnosed. According to the statistics provided by the Prostate Cancer Foundation, it represents 12% of all male cancer deaths. Despite prostate cancer being the most diagnosed cancer for men than any other, the research funding lags way behind funding for other major cancer types. It is all too often the case your chances of dying vary according to the postcode or the colour of your skin. If you are Aboriginal, your chances of surviving are 5 years after diagnosis are 9 times lower than average. If you live in regional or rural areas of Australia, your chances of dying from prostate cancer are 24 times higher than your metropolitan counterparts. Education and early detection dramatically improve the chances of survival, but with 70% of both men and women being unaware of the symptoms of prostate cancer, we clearly have some way to go. Nevertheless, inroads are being made. WA has 12 prostate cancer specialist nurses providing specialised care for people impacted by prostate cancer. They are based at Fiona Stanley, Sir Charles Gardner and Joondalup Health Campus. But the Prostate Cancer Foundation of Australia has plans to further expand this program into more public hospitals with the encouragement of the WA Department of Health. Through the WA Department of Health, the WA Cancer and Palliative Care Network Clinical Improvement Unit provides a statewide cancer nurse coordination service which is comprised of a team of specialist nurses located in both metropolitan and regional locations of Western Australia, providing support and information on diagnosis and treatments to patients. And the McGowan Government's WA Cancer Plan 2020-2025 provides a plan for the delivery of cancer controls and research to meet the needs of Western Australians impacted by cancer. Alongside this plan is the WA Men's Health and Wellbeing Policy, which aims to deliver strategies to improve the physical, mental, social and emotional wellbeing of men and boys living in WA. I would like to thank both Minister Sanderson and predecessor Minister Cook and the WA Department of Health for their ongoing efforts in ensuring Western Australians get access to the services and care they need. Meanwhile, the Prostate Cancer Foundation of Australia continues to do its amazing work. 18 volunteers support groups that bring together men and women who want to help those affected by prostate cancer. Most of those involved have either been patients themselves or a partner or a family member of somebody affected. And their prostate cancer telenursing service allows anyone, anywhere in the country, who has been impacted by prostate cancer to be connected to a prostate cancer nurse. They also bring together men and women who have a passion for helping those impacted by prostate cancer through their volunteer-run prostate cancer support groups and Mates Connect, a phone-based peer support service connecting those who have recently been diagnosed with a trained volunteer who understands what they're going through. If you've been affected by prostate cancer or know someone who has, please reach out to those services. I cannot imagine how much more life difficult would be for those diagnosed with prostate cancer if it wasn't for these people and organisations. Of course, there is still more to be done. Besides calling for a review of the national clinical guidelines for PSA testing to bring them in line with the current evidence so that GPs and patients can work together towards early detection, the Prostate Cancer Foundation also wants to see a doubling of prostate cancer research in Australia and a targeted awareness strategy to reach those at risk. I hope that on a national level, people are listening to the experts on this matter, because the McGowan government response to the pandemic keeps on proving over and over again the way to get it right when it comes to public health is to listen to the experts, and when we get it right, we save lives.